Healthcare data and tools has grown rapidly over the past few years, yet it's fragmented across many different systems, and so clinicians can't find the information they need in the moment they need it. A typical US hospital today runs 10 to 15 different connected medical devices per bed. Outside the hospital, users are adopting things like fitness trackers and other consumer healthcare devices and would love to share that data with physicians, and yet less than a quarter report being able to do so. Healthcare systems already invest heavily in interoperability, yet fewer than 15% of physicians report being able to access the information when they need it. More than 80% of physicians report that lack of data sharing between these systems increases their stress on a daily basis. Agentic AI can help us here. It is very good at crossing digital domains. However, in the healthcare setting, it really needs to understand the moment. It needs to be narrowly scoped to the data sources that matter for that patient and clinician at the time of interaction and no more. Security organizations have been outrun by the capabilities of these systems, so they need new tools to help them narrow it and keep it governed by policy. So we built a policy engine that allows us to synthesize the agents that understand these moments using the signals you already have. And so I'd like to give you a demo of that now. This is our demo visualizer, which mocks up an example care facility and associated systems. One thing to keep in mind as we go through this is there are actually 7 different digital systems modeled here, none of which are integrated with each other and none of which share data formats. To start, we have 4 separate rooms here that are labeled and vital stations in many of them. To begin, we're going to have patient 1 check in, and they're going to be checked into room 1. Now, as the nurse, we're going to spawn the associated assistant. We can now ask it to do things for us. So we're going to start by asking it to record patient vitals. Now, this is going to reach out to the vital system associated with this room right now, and it's going to then write to the patient EHR chart. So we're going to give it a moment to do so. There we go. It's retrieved the vitals vectors and has written them to the chart. Now we have access to the chart, so we can query for additional information. For example, has the patient had any surgeries? And now this is going to query the chart, and we're going to see what procedures they've had, and it's going to summarize it for us. All right. Now, it's not just the patient this has access to. Siblings of the patient have opted in and allowed their charts to be searchable as well. So we're going to see, are there any allergies within the immediate family? So this is actually going to go search for the siblings' charts and see what allergies they have to see if there's a pattern. Give it a moment. And one thing to keep in mind here is that not all of the patients are on the same EHR system. So it's actually going to search multiple different systems and summarize the information together. So there, Acme is group 1, IHC is the second one, and is actually pulling from both sets and seamlessly provide us with an answer. Beautiful. Now, clearly we have access not just to our patient's records, but to the records of patient 2 and patient 3. So we're going to try something here, and we're going to try to record vitals for patient P003. This should not work. Patient 3 is not in this room, and so this should fail out. And we're going to give it a moment, and we'll see how it fails out. All right, so it's able to read the vitals, which is correct. But here, it's going to attempt to write to the EHR, and that's going to provoke an error. It now may retry for the other chart as well, and that will fail again. This AI assistant does not have permissions to write to patient 3. All of this comes about because of this idea of a knowledge graph and the relationship between objects, and then transforming those relationships into the exact scopes. So on the right here, if I go into the MCPs and I look at the 2 EHRs, On EHR2, I have access to a certain set of tools. Now, the details here aren't hugely important, just to have access to a set of tools. But at the end, you can see the only scopes I have, I can only read from patient 2 and patient 3. That's it. If I look at the other EHR and go down, what you'll see is I have read and write permissions for patient 1. So this agentic assistant has exactly the right scopes for this situation. Now, this assembly changes. So I'm going to close this. I'm then going to move patient 0, 1 out, and I'm going to move patient 4 in. And now, when I relaunch, what you see on the right here is I actually get a different set of MCPs and a different set of agents, along with an entirely different set of scopes. So it's responsive to the changes in situations here. Now we're going to swap over to the Bifrost tool and take a look at how exactly this comes about. This is the Bifrost admin tool. It's used during initial setup and on an ongoing basis by IT and security teams to review the movement logs and assembly logs. Developers and designers will interact with the policy and context engine primarily through a REST API and associated SDKs. There's a lot going on in this tool, so we're going to do a quick overview of the various components, and then we'll look at one of the logs. The core elements are right listed here. These are the roles, which are your user roles, facilities, the places in which they work, characters, which are the collection of system prompts that determine the agentic persona and behavior at any given moment, along with the inference details to determine what model it runs on and how to connect to that model. MCPs are the model context protocol servers that model your various digital systems. Each one contains the details of how to connect, authenticate, and authorize, along with the list of available tools, how those tools are related to the scopes that are needed, how the roles get access to individual tools and which ones they get access to, and allows you to generate masks which narrow the list of tools depending on situation. Agents are more complicated remote workflows that communicate via an agent-to-agent protocol. Similar to the MCPs, each of these contains the information necessary to connect and communicate with the agent. Assets are a higher order building block. These represent a physical object that moves through the space. In this case, we have our patients and we have equipment being things like the vitals cart. An asset is bound to the MCPs and agents and narrows them to the specific element within it. So for example, a patient would be connected to the EHR, but it would also specify where exactly in that EHR is the chart that relates specifically to them. Collections typically represent spaces. These represent things like the clinic room. Similar to assets, they can be attached to MCPs. So if you have some clinic tools that need to be available in an OR versus different sets of tools that would be available in a clinic room, you could do that at this level. Additionally, collections contain the map between the role and the character, meaning in this environment, what character does the role get when you do the assembly? Finally, there are binding rules. These describe the relationship between assets and other assets or collections. These are things like patients being related as siblings or a mobiles cart being present in a clinic room. With that in mind, we're going to go to logs and we'll take a look at one here. Now, an assembly is the full descriptor that allows you to execute the agentic assistant. It contains everything from the system prompts required to the MCP connection details and remote agent details. It's synthesized in a moment based upon the role and the collection. And that is shown down here. The objects in orange are your collections and assets. The blue are the MCPs and agents. The connections are the binding rules. So in this case, we have a room 1. You'll see that there is an MCP here, which contains clinic tools. There is a pharmacy agent here. Additionally, there are 2 assets that are pulled in. There's patient 1, who was present in the room, and there's this mobile vital station. You'll see the relationships labeled here. So patient 1 is a patient of clinic room 1. The vital station is present in room 1. Each of these binding rules determines which of the MCPs below make their way through. But you'll see each of these assets also is attached to other assets. So for example, patient 3 is listed as a sibling of patient 1. Patient 3 has multiple different MCPs and agents associated with it, only some of which make it through. The ones marked in red here are filtered via the binding rules as they propagate upwards. You can see then that beyond patient 3, patient 2 is actually listed as a sibling of patient 3 and is pulled in as well. And this is how the assembly works. You have a model for your asset, which then uses those basic building blocks of MCPs and agents and filters them using the binding rules all the way up. This is how we end up with a full assembly that describes the entire set of digital systems and access points that we should have access to in that moment at that time. This synthesis method that drives the policy and context engine shown here keeps the agentic assistant narrow, focused, and understanding the moment, allowing your people to interface with the digital information they need at the moment they need it. Head to memory.io and reach out for a more in-depth demo or request access to our beta program. Thank you for watching.